afternoon. I'm Chuck Stone, Director of Operations for SEANC. Many of you know me. Some of you don't. I'm glad to see the faces here and welcome you to the board. I'm a past board member in 1986 to 1992. And today you've heard a presentation on some mess and just want to address a couple of things that if I were a board member, I would be asking. On slide 2, it uses 2014-15 data by Siegel to argue that the 70-30 is equivalent to a gold plan. I would be asking why we're not including 2016 data after the massive changes that were made to the 70-30 this year. Second question I would be asking about that, why Medicare retirees were excluded. And I'd be asking Siegel to provide the data for Medicare retirees choosing the traditional Medicare with PPO 70-30, because the plan changes to the prescription drugs would clearly show they're paying a much higher percentage of out-of-pocket costs by remaining with traditional Medicare and using the state health plan as their promised benefit. There are other issues I would like to address with that, but time does not permit. So let me return to something we have said before. I'm going to modify it a little bit today. SEANC has repeatedly proposed that pending some action that shows that VBID saves some money, that we look at an approach that links hospital reimbursement rates to Medicare rates. Not to pay Medicare rates, to pay Medicare plus a percentage of 15 to 20%. Center for Medicare Services says that Medicare rates produce a 5 to 6% profit. If we pay 15% above that rate, we guarantee hospitals a 20% profit. You pay 20% above that, you pay a 25% guaranteed profit. If they can't remain in business at that rate, then I suggest, folks, they need to become more efficient. They need to be better run. And today I would modify that with this proposal. I know the state health plan staff have repeatedly stated they don't think that will save money. But why not try it? Why not try it? And the way we try it is to look at those areas that have high concentrations of state employees and teachers. That includes the Triangle area. It includes the Triad. It includes Charlotte and Mecklenburg. It includes areas like Asheville that would cover the western section of the state. It includes Burke County where you have major state institutions and state facilities. It is time that we seek a different approach other than taking this money out of plan members' pockets. And again, going back to this, it's said that, again, out-of-pocket costs rise every year while percentage of out-of-pocket by plan members is claimed to have gone down. But as a percentage of their net income for employees who have not had but a 1.2% pay raise in 6 years, they have seen the percentage of their net income going to out-of-pocket medical expenses increase. Their family income has gone down. Let's change this. Let's try a different approach. Thank you.